Hello, everyone. We are here today with Dr. Drew Albano from Prisma Health. We are going to talk a lot about how Drew got into medicine, what are things that he's excited about, like today about medicine, what is the journey sort of really been, and what I think technology and AI could basically be doing for the future of healthcare. So very, very excited to basically have him here. Welcome, Drew, to the episode. We are thankful for you to be here.
Thanks, Abhinav. I'm glad to be here. Always appreciate the opportunity to connect with you and looking forward to having a conversation.
Awesome, perfect. So maybe we can get started, Drew, on how did you get into medicine? What was that like? What was the inspiration behind getting into medicine? What prompted that decision? What age were you? A little bit of the story would be great to start with.
Absolutely. So unlike I think most of my peers, I didn't start thinking about being a doctor as a little kid. I really had aspirations to be in the sports world as a sportscaster. Watched a lot of ESPN in my early years, and I think that was kind of the catalyst for that decision. As I was moving through my high school education, I had a science teacher pull me aside one day after class and said, have you ever thought about being a physician? And I had a candid conversation with him for about 20 minutes, and he wrote down on a piece of paper, what I would need to complete in terms of my undergraduate studies, my graduate medical education, and then, residency training. And I still have that piece of paper somewhere in my house to this day. But yeah, it got me thinking, and, the words he shared were really important. He said, with your interests, your skills and abilities, you could do a lot to help people. And it got me really motivated. And I would say that's probably 15 years old when I really made the decision to pursue. I was living in Long Island, New York. That's where I grew up, and I was in high school at the time. And and then from there, obviously followed the instructions and completed my college training. Went on to medical school in New York, and then residency in Florida, fellowship in Philadelphia, and then here I am today, after almost a decade in practice.
Awesome. So, in your fellowship, what was the fellowship in? What were you sort of practicing? That would be I think great for the audience to understand. I got a little bit of a flavor on that, but it would be great for I think people to sort of know a little bit of that as well.
Absolutely. So, as I'm sure most of the listeners can guess, I married my passion for sports with my interest in science and medicine, and ended up doing my fellowship in sports medicine. Trained at Jefferson in Philadelphia, and had the opportunity to train with the Philadelphia Phillies, which was a great experience. And got to work with those athletes, the coaching staff, and then also helped to take care of local high schools, some colleges, and other athletic events like the Philadelphia Marathon. So
fun job.
It's a very fun job. I mean, there's definitely pressure involved. You're taking care of very well trained, very skilled athletes, and you're trying to keep them fine tuned and on the field or on the court. So there's definitely that pressure, but I think it's very rewarding to see them achieve their potential and have success with their teams and on an individual basis as the sports dictate. But yeah, it's always nice to kind of be the helper in the background that kind of keeps folks on the right path, and I still carry that out into clinical practice, taking care of the non-professional athletes. There are a lot of weekend warriors, there are aspiring athletes at different ages, and so it's always been great to be involved in different capacities and trying to keep folks healthy, and just makes me feel like I'm following through on that discussion I had when I was 15.
Awesome. And what were your first impression when you got into the field of medicine? Is it something that you had hoped at 15? Were there good parts of it? Were there frustrating parts of it? What was sort of going through your head when you were 22, 4?
Yeah, going through medical school, I think I was probably 22 when I started, 22, 23. And, back then, there wasn't as much support from a technology side. So I think, studying and preparing for exams, it would have been great to have YouTube and all the other apps and gadgets and everything else. We actually had textbooks back in the day, which is hard to believe now, right? So, but I would say that going into medicine, a lot of what I expected, but it's been interesting along the journey to see that the implementation and transition towards more technology in the clinical and tertiary environment. And so I feel old when I say, like, I took the exam to get into medical school with a pencil and paper. We used to write the notes on patients in the hospital with a pen and paper. And then as I was going through my training and into my early parts of my career, we made that transition to electronic medical records. So that was something that, at the beginning of my training to the end of my training, it was very different, using technology in those clinical settings, like I said. But it was exciting, and I think it helped to make things much easier in terms of keeping track of patient information. You're not holding lots of pieces of paper in your lab coat. You're not losing information. Also, we saw the advent and further development of a lot of different resources like UpToDate. There was the physician's desk reference, which I think they now reframed it to the physician's digital reference because nobody carries that big book on their desk anymore. But yeah, reflecting back on my experience, it's been great to see the transition of technology into the healthcare arena, knowing that it was inevitable that it happened, and I'm glad I was able to kind of experience both sides.
Oh, that's awesome. And were there parts of it that you felt should have improved, right? So that's great. I think you talked about starting in a point where there weren't even EHRs, right? And we were sort of probably documenting everything on paper to where at least I think we have a health record and I think all of the decision support tools that have sort of been associated with it. But were there some frustrations with the technology adoption? Because we've heard I think a lot of burnout stemming from technology in general. So what was that sort of and did you feel some of that? Were there other things that made you feel this should improve in general?
Yeah, it's a great question, Abhinav. I would say that the portability of the medical record or the lack thereof has always been a challenge. And I remember even early in my training where, you would traditionally go down to the medical records office or you'd have to get faxes from an outside medical record for a patient. And it's even with the implementation of the EMR, there were still delays in getting that needed information or that data. And so obviously we've made big strides in that direction, but I still see that that's a hang up. And I really would love to see improvements in the portability of medical documentation. So we're not having redundancies, we're not having delays in care. That's been a big hang up for me, but I see opportunities and improvements coming along. I think the other piece that seems to be missing and has been missing all along is, how do we get patients more engaged and improve their health literacy so that they're more active participants. And I see that that's occurring, but I feel like with technology, or at least the rapid expansion of technology into healthcare and medicine, I feel like that's kind of been a missed opportunity thus far. I feel like, we're pulling patients in to some degree, with more ready access to their charts and their records, but really the clinical decision support really should be not just addressed to the healthcare team, the physicians, the APPs, et cetera, but it should be also directed towards the patient, right? And I feel like that's a missed opportunity. I mean, we do things like, after visit summaries or patient education materials that can be sent electronically, and sure, that's helpful, but really, how do we help patients become more comfortable stewarding healthcare, knowing that it's such a complex environment? And I think about it with, pharmaceuticals, with scheduling, with, other ancillary things like durable medical equipment, with imaging. How do we get patients to better understand and navigate, such a complex environment? Because I would say, if I weren't in healthcare, I wasn't a physician, I would have a terrible time trying to navigate it. And I think most folks would probably agree that without proper experience and education, it can be really daunting.
Makes sense. So maybe I think we can take a little bit of a switch from where you were an individual physician to jumping into leadership roles. And I think the responsibility set towards managing populations at large is a much larger responsibility set. What prompted you to sort of I think traverse that direction, and what did you sort of do? We've talked a little bit about I think those things, but I think it would be great for people to sort of understand how should they basically be thinking about it, and what were learnings that you sort of really needed to I think take that up, and once you've taken that up, how does that sort of really look like?
Yeah, it's another great question. I think as a young man, or even before adulthood, I was very fortunate to be involved in different leadership opportunities, whether that be on different athletic teams as a captain or co-captain. Served in different leadership roles, like in high school and then college, and so I think there was a sampling of opportunities and areas for me to kind of develop and understand how I should lead and how I can contribute, my interest, my passion, my skills to leading others. And then, once I, got into residency, I was fortunate, my senior, my third year of residency, to serve as a chief resident. And then I just kind of built off of that in my early career, serving in some kind of introductory leadership roles, working in medical education, working within the health system. And then from there, it really was recognition from other established leaders, seeing potential and taking a chance, right? And I think that's always something I'll be grateful for, is that there were key individuals along the way that said, I think you have a natural ability, or you have an ability to contribute as a leader. Let's see, if we can get you into some other opportunities. And that really took me from kind of that introductory working as more of a clerkship director in the medical school setting, to eventually a medical director of a clinic, to eventually a vice chairman of a department, to then now the chief medical officer of a network. And so I've been incredibly fortunate to be surrounded with so many supportive and really insightful individuals. And I think, at the end of the day, I have to always credit, family, like my parents and other, folks that have been close family and friends, to really always believe in your ability, even if you don't see it yourself, right? And I think that's been something that's nice, is, it's easy, and I can imagine, even athletes we talk to, you talk about the imposter syndrome, and I think that a lot of folks encounter that in some way, shape, or form along their way, and I've definitely encountered it myself. But the more I've served in these roles, the more I feel that I'm really aligning with my core values of wanting to leave a lasting positive impact and put people in positions of success, whether that's patients, whether that's colleagues, that's the health system, the network. I mean, it really is motivating, inspiring, and feels very fulfilling for me as an individual. And so hopefully the folks that work with me always feel like they're part of the team and not reporting to me or working for me. Working with me has always been the key, and I think that probably stems from my early days playing a lot of sports, where it's a team effort. You're always trying to help everybody achieve their best, and I think that's been the leadership style that's worked well for me.
Awesome. And as you've sort of now been managing a network, value-based care has been there for a really long period of time, but it's not really sort of taken to the point where it's realized its full potential, right? What has been the bottlenecks you sort of feel? How can basically technology, data, and some of these things actually help solve for some of these things? And are there also things that the community, the medical community at large, should sort of be doing to advance value-based care in general?
Yeah, so the challenge, as I think listeners, and I'm sure you can attest to, the challenge with value-based care is that it's really helping to prioritize primary prevention, secondary prevention, and in some cases tertiary prevention. But the end goal is the end user, the patient, really has to be the one that takes ownership of that prevention, right? We can guide and steward and recommend, but if the patient isn't following through on the lifestyle modifications and the screening measures, then that value-based journey or that value-based care kind of starts and stops with them, right? Versus the fee-for-service model, which is what we're kind of we are very accustomed to. That's more the transactional of acute illness, acute injury. I take care of that, or the team takes care of that. We get you feeling better, and then there's a transaction, and then you get back to your routine and regular life. But I think for value-based care, it's just the challenge that we run into is how do we orient patients and populations to seeing value, not monetarily, but the lasting impact on morbidity and mortality for those earlier interventions, to again prevent the onset of disease and certainly the worsening or the sequelae of disease once they present. And so I will tell you, from a network standpoint, the goal is always to try to make it easier for folks, and that's for all folks involved. So that's our colleagues, the healthcare team members, the patients, their families, the communities. And so ways that we try to use technology to do that is, to help with scheduling. I know you and I have talked about it many times, is, how do you seamlessly schedule folks for that mammography or that wellness visit That's where technology can certainly help. Are there ways that we can, better educate folks? It goes back to the health literacy piece and keeping them abreast and informed of the most current recommendations. And then I think on the EMR side, which I know we talked about earlier in the conversation, is, how do we create efficiencies and shortcuts so the clinicians can easily navigate the EMR, capture the requisite information, and then be able to move on to the next task without being bottlenecked or bogged down by administrative tasks, which I think we all can agree is a distractor in healthcare, right? And it goes back to the early points about the EMR. So I think for us, it's really, how do we best engage patients? And I think solving for that is going to really help us make that transition to value-based care. But as of right now, we're still kind of jockeying between the two models. And I think once we can get the population to really align with the importance and longitudinal value in value-based care, not the monetary value, right, I think that's where we're going to see that transition. And the fee-for-service model, I think, will always have a role. I just anticipate it'll probably be in more of the technical specialties, like surgical specialties, and less so in like the cognitive specialties, where there's more kind of abstract management of a disease process or multiple disease processes, rather than, how much does it, what's the time, effort, energy, equipment needed to replace a hip joint, for example, or, do a cardiovascular surgery. So that's where I see kind of the fee-for-service model probably will still have a role. It just may not be as much in the cognitive and preventative medicine area. So
makes sense. So basically, like, your journey has sort of been from the aspiring 15-year-old wanting to sort of be like a doc to working with one of the best sports teams to then basically leadership roles in a large sort of network, and through this entire journey you've probably seen a lot, right? So I think my final question for the day is what are your hopes and aspirations for the future, and what do you think should sort of happen over the next 5 to 10 years as we see healthcare sort of really evolve, and as a leader in the space, I think it would be very helpful for me to sort of get that view from you as well.
Absolutely. So I mean, you're very attuned in technology in general, but certainly in healthcare, and I think that's where I see the evolution of using more AI-supported resources, and I think it goes along with some of the work that's already being done in language capture, language processing space to help with clinical documentation, knowing that we need to have that done. I think also from a clinical decision support, I think that's where AI is going to be very helpful to, help clinicians, clinical teams wade through an increasing amount of information, data, research, et cetera, to give really evidence-based recommendations and guidance. And then I really think, on the patient side, I know we talked about this before, I feel like AI can really do a lot to help, again, bridge the gap for health literacy, to help patients navigate treatment plans. Mm-hmm. And I kind of envision that in the future, as a physician, I can see a patient, I can say, I recommend that you start this medication, you get this imaging study, you go see this therapist, and you have this referral for a specialist. And using AI, that would help the patient navigate and coordinate all of those key elements. And by doing so, the anticipated success rate would be very high. What we've seen anecdotally is that, unfortunately, most patients struggle to do one or more of those things, and it's not because they're not interested, they're not engaged, it's just due to limitations that I may not be aware of as a physician, that it may be a social vulnerability or social determinant, or it just may be a discomfort with navigating the healthcare system and not really knowing where to go to meet or exceed the requested intervention. So that's where I kind of see in the next 5 to 10 years is that AI is going to help improve efficiencies on both sides of the clinical encounter. And then I imagine in the future it will also help with risk stratification. There'll probably be opportunities, from a genetic standpoint to even have improvements in tailored therapies and tailored approaches to patients rather than using kind of the best guesstimate, which is kind of what we do and now is more weight-based dosing for certain medications, or we have a starting dose and then we have to titrate and taper, et cetera, to get to the therapeutic dose. And so I think with the expansion of technology and resources, I think we'll be able to move away from the trial and error approach to medical management and more to a targeted approach.
I'm into that. This has been amazing, Drew. Thank you so much for sharing a lot of your hopes and aspirations and learnings with the audience today. Thank you so much for being here. It was an absolute pleasure to have you and host you here. Again, thank you so much.
No, it's my pleasure. I always enjoy getting to talk to you, and I hope the listeners enjoyed our conversation.